Namaskar and a very warm welcome to the 23rd edition of the phone-in program. I'm Nidhi Kumar and you're watching India Science. Even as India grapples with the second wave of the COVID-19 that has left health systems across the country crumbling, experts are already calling for preparations of the third wave, which they predict will hit the country sometime later this year. As far as today's figures are concerned, India reported 53,256 new COVID cases and 78,190 recoveries in the last 24 hours. As per the Health Ministry's update, India so far has vaccinated over 28 crore people. In this program, we get you the most credible advice ever, and we'd also like to extend our very good wishes to the entire country on a very happy International Yoga Day 2021, which focuses on well-being and health. And in this phone-in program where you can ask your questions, we take your queries live. So today we are joined by the very eminent Dr. Manjari Tripathi, who is the head of Neurology, All India Institute of Medical Sciences, New Delhi. Namaste and welcome, ma'am. Such a pleasure having you here with us today.
And thank you, Nidhi. It is my, pleasure too.
Yes, ma'am. So if I may ask you the first question, ma'am. WHO has said that the Delta variant is on its way to becoming globally a dominant variant. We now have the Delta Plus also. So how would you like to speak about the vaccines and their efficacy and effectiveness against this variant, and can reinfections occur?
Yeah. So, there is this concern about the various mutations which happen to the virus, and the virus must mutate in order to survive. There is an immune pressure on the virus, and this causes various structural changes in the surface of the virus. The structural changes happen on the spike protein and other areas. This leads to variants, and we know that the Delta variant is responsible for about 30% or little more than 30% of patients with COVID in India in the second wave. So also the Delta variant has spread, is there in the UK, is there now in the US, and there is this concern that this variant of concern is now almost global. We know that the vaccines were developed when the virus was in the initial stage, and we know that there are various types of vaccines. There is an inactivated vaccine, which is the Covaxin, and you'll be glad to know that Covaxin is effective against the Delta variant. We also have mRNA vaccines, which are the Moderna vaccine and the Pfizer vaccine. And you'd be glad to know that studies have shown that these are effective too against the Delta variant. So really we do have, and Covishield too. So we do have information now to say that the vaccine is effective against the Delta variant. But I'd like to add another, thing here is that we know that this virus is going to keep on mutating. So, there may come a time where the mutations are not, being affected by the vaccine. Now, 50% of the vaccine is the vaccine, or the 50% of the prevention is the vaccine which we take. The rest 50% is the change in behavior. Unfortunately, change in behavior, this vaccine of change in behavior is much, much more difficult to, adhere to than taking a simple jab. So most of us are used to treating diseases and getting relief from problems by swallowing a pill. None of us so far have been accustomed to prevent a disease by change of behavior. So really 50% of the vaccine, of course, coverage is going to be the intramuscular preparation or the intranasal preparation, whichever comes out. But the rest of it is the behavior vaccine, the CAB behavior, which really needs to be looked at, particularly when more and more variants come up.
Thank you so much for those insights, and I truly agree. that India is at that behavioral and social change, and we're at the frontiers of these change, and they have to come in. Ashutosh, meanwhile, joins us from Mumbai. Namaste, Ashutosh ji. Welcome to India Science. Please ask your question.
Hello, ma'am. My question is, ma'am, could you talk about what specific neurological effects we are seeing in some COVID-19 patients?
Okay, that's a very good question. So the neurological effect could be during the COVID infection or after the COVID infection. So if you see during the COVID infection, the neurological effect which is commonest and which was kind of detected first was the loss of sense of smell. So that is because of involvement of the olfactory neurons which are very close to the nasal mucosa. Apart from that, during the infection, we also can see headaches during the infection. In a little more severe cases, we can see involvement of the nerves in the form of facial palsy, which is known as Bell's palsy. And little more severe, during the infection, we can find involvement of the peripheral nerves giving rise to a kind of GB syndrome, which is a syndrome which involves the peripheral nerves and the radicals. And also, a little more severe, we are seeing an association of stroke because we know that the COVID infection triggers a procoagulant or a prothrombotic state. So we are also seeing strokes. We are seeing young people who are coming in with intracranial bleeds, that is hemorrhage in the brain. And we are also seeing young people come with venous strokes. So not only just ischemic strokes, hemorrhagic strokes and venous strokes. So all these are happening, and then during the infection and as the patient goes along, there is an entity known as brain fog, or there is a decline in memory and a decline in alertness and an ability to remember things. Apart from this, COVID is causing significant changes in sleep. People are having interrupted sleep, disrupted sleep, insomnia, and irritability increases. So these are during the infection. Now post the infection, that is after the infection, also we are seeing a lot of strokes come in. We are seeing again GB syndrome, which is another entity. We are seeing this brain fog continue and transfer into memory loss. So there is a decrease in performance and there's decrease in memory. And we are also seeing people having headaches post-infection. We are seeing people having persistent loss of smell, and there's a new interesting thing which has come up, which is phantom smells. That is, they've had loss of smell, and when they recovered, they are experiencing phantom smells. Phantom smells means all of a sudden, they start smelling something very bad or some smell which is not actually existing in the environment. So really, if not just for the COVID, because we know that in about 80% to 70% COVID infection is very mild. But in another 10%, it can be moderate. And in the last 10%, it can be severe. And we know that these neurological manifestations can occur. So most people in this country, particularly the youngsters, should be aware that we have to protect ourselves from these severe effects of COVID. Thank you.
I hope that's answered your question. We are joined by yet another caller from Chandigarh. Ruhanika, welcome to India Science. Please ask your question. And those are very good insights, ma'am. I must say that we learned a lot from whatever you spoke right now. And we will continue to speak because these kind of cognitive memory loss, dementia are all flashing on the screen right now. Yes, Ruhanika, please ask your question.
Hello, ma'am. This is Ruhanika from Chandigarh. Actually, my question is, ma'am, as we know that COVID-19 is a respiratory illness. So, ultimately, how does a respiratory virus cause damage to our brain and nervous system?
See, COVID is something, Ruhanika, it's a very good question because COVID is something which we didn't know anything about prior to 1.5 to 2 years. We really had no information. Now, let me tell you, most viruses are neurotrophic. So what is neurotropism? Neurotropism means most viruses, particularly COVID, now we know through all our research And you know what kind of research? This is the kind of research we should look forward to doing in our country, and you youngsters should lead it. There is a pool which is known as a bank. This is the UK COVID, bank, biobank. So the UK COVID biobank has registered more than 40,000 people in that UK COVID biobank. And in this biobank, what happened is, as the COVID people came into the hospitals, whether they were mild COVID, whether they were moderate or severe, the doctors there, because they take consent for the research, drew their blood, drew their samples, did their MRIs. Can you imagine? Consenting people had MRIs, even though they did not have neurological problem, or some of them may have had neurological problem. Some of them who consented underwent MRIs. Not only they underwent MRIs during the infection, after they were discharged home, this biobank called these people back after a duration of few months to repeat their MRIs. And to their astonishment, these researchers found that COVID is causing loss of volume in the brain in very vital structures like the left hippocampus, the left mesial frontal cingulate gyrus, causing atrophy in the thalamus, causing atrophy in the gray matter. So can you imagine this beautiful kind of research, elegant research, where people offered to get their MRIs done and then follow up. So the UK biobank researchers could then publish and show that this virus is a highly neurotrophic virus and it is affecting the brain. And unless we know this, we are not going to be serious about protection. And we are not going to be serious about our research. We need such research. We need youngsters who are doing science, who are into laboratories and tie-ups with hospitals to do such sincere research to understand the gravity of the situation that we are grappling with.
And thank you so much for taking that question and telling us more about research and innovations and such like things that are much needed in times like this when the SARS-CoV-2 has completely bowled us clean. We have yet another caller, Sahil Garg from Noida. Namaste. Namaste, Sahil ji. Please ask your question.
Ma'am, my question is that my sister has COVID-19 and she partially forget things. Can you explain this?
She's partially...
Can you repeat the question?
Ma'am, my sister has COVID-19 and she partially forget things. Can you explain this?
I think...
Yes. So COVID-19, as I told you, in some fraction of people who have it, can cause memory problems. It can cause brain fog. And first and foremost, we have to understand the mechanisms. One mechanism is if the person has had hypoxia. That is, if the oxygen saturation has fallen. You would know that the brain consumes the maximum oxygen in the body. So if the oxygen is falling, the brain is not getting its nutrition. So the memory will come down and there will be a decline in performance. So that is the number one cause. The number two cause is now we know that the virus has a neurotropism. It affects the gray matter. It affects the left hippocampus. The left hippocampus reduces in size based on the data we have from the UK biobank. And when it reduces in size, what is the function of the left hippocampus? The left hippocampus is responsible for verbal memory. It is the structure which stores our memory so that we can retrieve it at a later date. That is affected in COVID, and hence memory is affected. Doctors are still devising strategies as how to counter it. We do often advise serum B12 tests and thyroid tests because low B12 and low thyroid can also cause a decline in memory. If that is normal, then there are certain tablets and medications which can help out with memory and can be restarted. Apart from that, rehabilitative strategies like reminiscence therapy, writing down what is important, and repeated, reading or repeated instructions is something which is needed. I'm sure she will recover from this. Just give it some time. because anxiety about this can itself worsen the memory. So please reduce the anxiety and she will slowly show recovery, and let's hope, she is much better.
Thank you so much. Again, I have no words to say. We learned so much from this conversation of yours. I have 2-3 questions going on the MISC syndrome on the YouTube. I'd like to take them with you, ma'am. Black fungus is overriding SARS-CoV-2. Please tell us about the multi-inflammatory syndrome.
Yeah, so, unfortunately, the COVID came, and because of COVID, there were several things which happened. One, of course, is that COVID itself reduces the body's immunity. So the immunity has come down. And when the immunity has come down, remember, immunity is the host factor. In any disease, there are 3 factors: the host, the agent, and the environment. So let's take the host factor. Now, because of COVID, the immunity has come down. When the immunity comes down, the WBC, which are the cells which are responsible for fighting any infection, are down too. And then various other markers and various other, protective things in our body, they also come down. So alternate infections happen. There can be bacterial infection, but this time there was fungal infection. So there was black fungus, there was white fungus, there was mucor, there was aspergillus, there was candida. So all these fungus, they attacked us. The second factor which I told you is the agent. The agent is a virus. Now this virus has an affinity, for increasing the ferritin. We know we are doing ferritin levels in these patients, and the ferritin levels are actually very high. So the fungus has an affinity to this ferritin, and as a result, there is more fungal infection because of the agent having an increased ferritin level. The third factor is the environment. Believe me, the masks which most of us wear are not washed. I'm talking about the common people. They wear the mask and they leave it wherever they want to. They leave it moist. There is sweat. Now we know that if we keep a piece of bread for a long time and there's water on that bread, there will be fungus. Similarly, if we leave a mask and we don't show it to the sun and we don't sterilize our mask, we are going to end up having fungal infections. The other reason in the environment is the homes. Many homes in India, unfortunately, have sogginess. Whether it's the toilet, you can see that the walls are wet and there is, cracking of the plaster. And when you examine it, there will be a fungal growth. So the environment in which we live, apart from that, many households, they do not have the luxury because they do not have the resources. They are living in an environment where next to their house, there is a garbage dump, or next to their house, there is trash thrown. So these are all, fertile soils for fungus. Plus, many COVID patients do not and cannot maintain personal hygiene because they are so weak. So when they are weak, they are not even able to wash their mouth or gargle their mouth. They're not able to wash their private parts. They're not able to, clean their mouth and brush their teeth sometimes. So the oral hygiene goes, the throat hygiene goes. As a result, the fungus is gaining access to our body. So host factors, environment factors, and agent factors gave a perfect storm, gave a perfect cocktail of disaster. And there was this fungal infection which affected many of our COVID patients, which is really unfortunate because the fungus infection is very reclaratant. It is a very stubborn infection and it can affect the nose, the sinuses, the brain, and the blood. It can go anywhere. So really, some patients actually lost their life because of the fungal infection. Some people had to undergo extensive surgeries of the face. Some people had to undergo surgeries of the brain. And of course, take the treatment for the fungus, which again is a very, very intense treatment. And it has side effects. The fungal treatment causes, effect on the kidneys. So you really, and there's so many things which go haywire then. So the doctors can't push the drugs. They have to go very slow with the drugs. So this is, in a nutshell about the fungus. And that is why we must keep these three factors. You have to beat the agent by staying strong as a host and by keeping a clean environment.
Very rightly said, and I think we need not be alarmed, but the least that we can do right is to wash our masks and, of course, be alert and aware all the time that there is a virus that is smarter than you and I, and it can attack. It hasn't gone down anyway. We are joined by another caller, Shivani from Gwalior. Namaste, Shivani. Please ask your question.
Namaste, ma'am. My question is, there has been concerns over the third wave affecting children more. I mean, because they're not eligible for vaccines yet, and there is a threat of more dangerous variants emerging. So I just want to know, could you please shed some light on this?
It's a very good question. We should remember that the children are the protected people. They have been indoors. They have not been going to schools. The vaccine is not yet out for them. At least the studies are going on. Trials are going on. You just can't go and give the vaccine in children because you really don't know its effects and side effects. So it has to undergo a phased research, a phase 1 trial, a phase 2 trial, and a phase 3 trial. Then it goes to the community for a bunch of kids getting it, and then proving its safety, and then giving it to the rest of the kids. Now, yes, because kids have been indoors and because the vaccine has not been studied in them and trials are ongoing, they are a vulnerable population as of now. And one must remember that many of the middle-aged adults and adults, they have been exposed to the virus, and so they have developed antibodies. Now, you'll be glad to know even children in our country have these antibodies. A good amount, 32. One survey says almost 30% children, and another I was reading was almost 50% children have these antibodies. So let's hope that the children stay protected. But we must advise them on, again, CAB, which is COVID appropriate behavior. We must advise them on, getting good nutrition. Believe me, many children in this country have two kinds of bad nutrition. One group is those who have no resources and are poor. So they have malnutrition, that is, they are malnourished. They are malnourished. The other group of children are malnourished. That is, they are nourished in malls. They are using junk food. So both ways, if the child is not nourished well, and if they're eating wrong stuff or not getting food to eat because they're poor, and or getting too much to eat, which is junk, their immunity is not going to be strong. So the good old Indian diet of, having your haldi, your dal, your sabji, your roti is something which we must inculcate in our kids, apart from taking fruits, apart from taking, your tulsi, whatever. So make sure that your child's immunity is good, so that even if there is an infection, it is mild and we can tide over this, predicted thing in the children. The other is, of course, the frequent hand wash, hand hygiene, and of course, very important is fomites. Now, children are very used to, just exchanging things with their friends, whether it be a ball or whether it be, some attractive clay object. So we have to kind of tell them that, hey, for the next few months, stick on to your things, and if possible, do not exchange stuff, fomites going from one house to another. So this is the way I would advise the children, and there is no need to panic. What should preempt panic is knowledge and prevention.
I hope that answers your question, and I think India must eat right. And this year being the year of well-being and yoga, we must take a pledge to eat right, the correct nutrition, a sustainable and healthy diet to make more antibodies, like the doctors just now told all of us. We're joined by yet another caller, Ruchi from Lucknow. Namaste, Ruchi. Please ask your question.
Hello, ma'am. My question is, what kind of complications do people normally suffer after recovering from COVID-19?
Yeah, thank you, Ruchi. So, the most important thing is the severe fatigue. Okay. They are so fatigued that they are unable to kind of do their routine activities, even simple things like personal hygiene of bathing, looking after their personal grooming, that is affected because of the fatigue. Then there is muscle pains and aches, body aches. Then of course is cough. The residual cough, and it is quite a racking cough because it just goes on and on. That is also something which is really debilitating. Apart from that, they can have hair loss, which is, of course, not, of significant, morbidity, but it is concerning to, people who are concerned about becoming bald. Joint pains, arthritis. Apart from that, there can be, heart issues. There can be chest pain, myocarditis. So there can be sudden, tachycardia or, rapid rhythms in the heart. There can be pericarditis, the breathing can become painful and slow. So breathing issues can be there. As I told you, neurological manifestations are huge post-COVID, like brain fog, memory decrease, decrease in smell, decrease in taste. Imagine you're not even able to taste your food. It tastes like cardboard. So it is quite miserable. And of course, there can be, muscle weakness and neurological nerve weakness, strokes. These are the more dreaded ones. It's basically sometimes patients describe, when I talk to patients, they feel that they are like walking zombies. They are empty in their head. Their sleep is disrupted. They are not able to think clearly. They are not able to do their personal things. They are dependent on people. So really, again, prevention is the key here, because one doesn't want to end up being like that if you have been a healthy, normal individual, before.
Absolutely, and I think we also call it long COVID. Meanwhile, we are joined by yet another caller, Rohit from Delhi. Namaste, Rohit. Please ask your question.
Ma'am, my question: what should we do to prepare ourselves for a third wave if it occurs?
Yes, this is a very good question. See, as I said, it's easy to take a pill, but it's difficult to change behavior. I think it is time that we change our behavior. We have to learn to kind of be distant with people about, 2 meters or so. When we talk, we shouldn't stick to them. We should avoid going to markets. As far as possible, whatever is orderable online, order online. Believe me, everything is available online. Or make friends with a local grocery, local vegetable fellow. I am very friendly with my vegetable fellow. I have him on WhatsApp and he gives it at home. I don't have to go out to the market to buy it. So minimize, before you step out of the house to go to the market to buy something, think 10 times. Is it necessary for me to go out? Is it necessary for me to buy this thing? Cannot this thing reach me on its own? Okay, it may not reach me today. It may reach me tomorrow or after 3 days. But is it so urgent? So those people who are wandering about just for going to shops and markets to buy stuff, they should stop immediately and should look for local vendors who can provide it to you at home, and most are doing so that the markets are not crowded. Believe me, if you go to Lajpat Nagar, if you go to Sarojini Nagar, they're chock-a-block. This is terrible. We are going to have a third wave which will come in early because of this behavior. This is wrong behavior. It should completely be, stopped. Then, of course, we must try to convince our offices to stagger work timings. So if there are 10 people in an office or research lab, there should be staggered timings or alternate days or schedules. For my research lab, I have many research students and PhDs. I have given a roster. So Monday, these people come. Tuesday, these people come. Wednesday, these people come. The rest of them are informing me daily. We have a common WhatsApp group, what they have done on that day through WhatsApp. So I don't need to see them. They are preparing their manuscripts. They are doing their research studies. They are reviewing literature at home. So, this is a method I have followed. But in most offices where work from home is possible, they should work from home. In most offices where like government offices, they should straddle office. They should, before the COVID, a lot of people used to spend a lot of time just taking coffee and tea. That has to completely stop. No coffee and tea in office. I have my workforce, I say you're not getting your lunch to office, you're not getting your coffee and tea and going out and enjoying in the canteen. You come for less number of hours. So suppose somebody is coming from 8 a.m. till say, 12. So half of the staff come from that time, then they go free to go. They finish all their work. So they work at breakneck speed and finish all their work at that time. Then of course the next shift comes from 12 and maybe to 4. And then if there is a need from 4 to, so if you have 10 staff, you divide them into 3 or 4, 3, 3, so that, they are adjusted across the day and there is no crowd in the metros at the peak hours. And there is no crowd on the roads and, congestion at the peak hours. So if you staggered it out. So all these changes need to be taken. Apart from that, we need to make sure that we as a population are not spitting in public. We as a population are wearing masks all the time, preferably double masks, so that, there is no aerosol which is going out. We also need to avoid closed door meetings. We should not be in closed doors. So, because we know that this virus spreads through aerosols, if you have to meet people, call for an open door meeting, which is in a non-crowded area, non-congested area. For example, in my house, if somebody comes to meet me, I have a table and 4 chairs outside my house, and I please tell them that don't think that I'm being rude, but the fact is that I'm just going to be conversing with you outside, and that's it. And I keep these disposable water bottles, which if they're thirsty, they have. So really, the kind of hosting and all has completely changed. Avoid going for marriage parties. In fact, marriages should be just, just 10 people or 12 people, not more than that. This is the time where marriages need to be really, shrunken. It cannot be the big fat Indian wedding. Avoid going for all these, parties and group meetings. Talk to your friends. Use tech support. Talk to your friends on WhatsApp. Talk to your friends on mobile videos, on Skype, on FaceTime, what have you. Technology has been made for this day. Technology of, conversing with people without actually meeting them face to face has been made for this day. You can thank God for it. So use that and minimize the risk of contracting or giving COVID to other people.
Thank you so much for those insights. I think very relevant. And I'd like to just add to this here, as we're unfortunately absolutely short of time, that we need to vaccinate. And as Dr. Manjari has said, we need to keep social distancing and mask up India. And at this stage, I'd like to thank you for joining us today. And I request all the viewers today not to panic, keep your faith, guard yourself. And if you're stepping out, wear a shield as well. Wear the mask. Mask up India. On that note, many thanks for watching. Namaskar.